to our first podcast, Recovery Through Motion, and episode 1, FES 101. So just to be clear, FES, Functional Electrical Stimulation. We're going to be referring to it as FES, but it's one in the same. So before I get to my distinguished panel, my name is Scott Chesney. I'm actually a 35-year survivor and thriver with paralysis. And as I'll be talking about throughout the program too, is that I give so much credit to functional electric stimulation, FES, for where I am in my life. It's been helpful in so many ways that I'll be sharing with you, but we wanted to create a program here tonight where we're able to give you answers. I know there's a lot of unanswered questions out there, and we want to give you the answers that you're looking for. So we're going to take it to the basic roots of FES and bring it up to the present and where it is now and why it's so beneficial to you. So hopefully everyone out there, we're not saying that FES is for everyone, but what we are saying is that we want as many people as possible out there to at least give it a try, kind of take it for a test drive, see if it works for you. And if it works for you, I'm sure that you're gonna benefit as many people have with everything that FES can provide with you. So obviously I'm going to share my perspective, but I got an esteemed panel here of guests with me tonight. And we wanted to bring somebody in from the medical field. I don't think there's anyone better than Dr. Cristina Sadowsky, Associate Professor in Physical Medicine and Rehabilitation at Johns Hopkins School of Medicine. She's a clinical director of the International Center for Spinal Cord Injury at Kennedy Krieger Institute in Baltimore, a program caring for both children and adults with spinal cord related paralysis, and built on the philosophy that functional restoration is activity dependent and can be best achieved through structured medical rehabilitative interventions. She is board certified in physical medicine and rehabilitation and spinal cord injury medicine. How are you, Dr. Sadowsky?
Scott, hi. I'm really excited about this podcast. I'm happy to be here together with all the rest of the good people of the world, of the FES world.
Well, we're very excited to have you with us again. You're the best of the best. And then we move on to Gabriella Stiefbold, who is an occupational therapist with extensive experience in the area of spinal cord injury rehabilitation, providing direct patient care, mentoring, and presentations on the topic of spinal cord injury for over 20 years. For the last 4 years, she has worked as a clinical representative for Restorative Therapies, representing their line of functional electrical stimulation systems, supporting the sales process, and providing clinical support and training to the clinics in the Mid-Atlantic and Northeast. Gabriella, how are you this evening?
Very well, thank you. Thanks for having us. I'm excited to be here.
Thanks for joining us. And last but not least, we have Wendy Warfield, who is the clinical educational manager at Restorative Therapies. As an occupational therapist for 18 years, Wendy has extensive clinical experience treating a wide range of patients with neurological conditions from both adult and pediatric populations across the continuum of care, including inpatient and outpatient settings. In her current role, Wendy enjoys the unique opportunity to collaborate with clinicians around the world, facilitating best practice in the use of FES therapy systems to improve rehabilitative and physical health outcomes across a wide range of patient populations. Wendy, how are you today?
Doing great. Thanks for having me.
Oh, thank you for being again, we only assemble the best team here. And to begin this, and they don't even know this is coming, I wanted to know, so we talk about FES 101, history, Google it, Wikipedia, electrical stimulation had been utilized as far back as ancient Egypt, when it was believed that placing torpedo fish in a pool of water with a human was therapeutic. Now, I don't know if they knew that, but I didn't know that. And I didn't find it on the bottom of a Snapple bottle, but I thought we would start with that. No, that's not going to be the question. Dr. Sadowsky, let's just really dive into this. What is functional electrical stimulation, and why is it important for those with spinal cord injury?
So, Scott, functional electrical stimulation is a technique that uses low energy electrical pulses to artificially generate body movements. And individuals who have paralysis that is due to an injury to the central nervous system. That's the traditional definition. FES involves stimulating the target organ during a functional movement, like walking or reaching for an object or swimming or so forth. So that's why it carries the functional in front of it, as opposed to electrical stimulation, in which you do direct stimulation of the nerve and the effector, the motor effector, the muscle. You started with the torpedo fish, and actually the term of FES was coined in 1967, also from Wikipedia, by Moen Post. And the truth is that FES has been used ever since, traditionally, continuously, ongoingly, and it became standard of care in treating individuals with spinal cord injury sometime in the late 1990s, start of 2000. The main application of spinal cord injury is restoration of limb function and regulation of organ function, like breathing, coughing, bladder and bowel function, penile erection and ejaculation, improvement in cardiovascular performance, prevention of osteoporosis and joint contractures, control of spasticity, and many, many others. FES is also used for treatment of pain, pressure sore prevention and treatment, and increase in muscle bulk.
So there are a lot of different applications for it. So take us through the evolution of FES then. How is it used now and the growth of FES?
So I have to say that I think that in the 1960s, 70s, and 80s, we were a little bit more daring in our application of technology. So FES had a great increase in usage in the 60s and 70s and 80s, and in treating individuals with spinal cord injury. And ergometers have been devised. Clinical studies have been done looking at the effect of Selfesteem and FES in triggering movement in paralyzed body. But for some reason, we became a little bit skittish in the 1990s, and there was this drive to only use FES for clinical studies that have been proven beyond reasonable doubt in the population with spinal cord injury. Well, that's basically a non-starter, because while it is a devastating injury, spinal cord injury is not frequent, and you, Scott, probably can speak about that. So devising a study that is a prospective, randomized control study to prove FES outcomes is not the easiest to be done. And in fact, probably that a perfect study doesn't exist. But we can't stop using good technology because there is no perfect study. In spinal cord injury field, there will never be a perfect study. It will be a good study. So we have to learn from clinical practice, from well-devised small studies, and we have to keep pushing the envelope. So thankfully, we do have a lot of clinical studies that are showing how important it is for spinal cord injury individuals to be using FES.
Wonderful, wonderful. Let's, we're gonna do this now. So we have now, our next question is for Dr. Sadowsky. What health benefits come from using FES? And how does it apply to the SCI, spinal cord injury population?
So I'm going to start with something that is really cool about FES. Do you think you can play that video on loop?
Is it going?
Mhm.
Okay.
Yeah. Okay. So if you really look at that video, you see that the FES is applied to the lower legs, to the legs. So it doesn't only power the muscle, the effector. It also activates what we call a center pattern generator. And if you run that video again, look at the arm of this individual. She has her legs being stimulated. The quadriceps and hamstrings are being stimulated, but the biceps, triceps, and even the finger flexors get activated through ascending inputs. So my first thing that makes me excited is the fact that FES, it's not only giving people muscle and bone benefits, it's doing central nervous system restorative activity. How cool is it?
It's movement.
It is movement, and it is effective movement. It is finger flexion. It is pattern activity of the upper limb that could be used for reaching and grabbing things. So yeah, of course it's cool.
I'll never forget, Dr. Sadowsky, the first time that I just saw a muscle twitch as a result of FES. It was just amazing. It was almost like I never thought I would be able to do that before. And then when you take that to another level and watch your body move in a way that it did before, it's almost like miraculous. And I have to believe that mentally that's doing something for each person who's benefiting from this.
I am pretty sure that your word is very powerful right now.
Well, let's move on.
Yeah, so we're moving to those physical benefits. So first of all, this is a study that was done in the early 2000s. It involved a group of 20-something to 30 individuals that used FES on a regular basis during these are all individuals with chronic paralysis, and they just used FES ergometers just like you do outside of clinic. And we matched them and compared with the same amount of individuals that that had spinal cord injury. They were matched for age, for level of injury. And you can see in the left panel that individuals that had FES to the muscles that were stimulated, which are actually the anterior thigh and the posterior thigh and the gluteus, had significant increase, statistically significant increase in muscle mass compared to the ones in the white column that did not. Now, we did use the sternocleidomastoid as an internal control. So this is the muscle right here to show that the two groups were equal. So what was unequal was if you do the work, you get the muscle. If you look for those individuals that are more visual, we took MRI slices, and you can see on the right that the subjects have a lot more of the black stuff. The black stuff is muscle in the leg. The white stuff is fat. Fat is not a metabolically active cell. We want the muscle. The muscle is the cell where the lipids, the actual fats that we're ingesting, and the sugars are being metabolized. We need those cells to exist, not to be atrophied and replaced by fat. FES also improves spasticity, and that is that small, the mid panel there where you have the angular velocity, because a lot of people are saying, well, if you strengthen a muscle, you're going to have all this terrible muscle spasms because your muscle is stronger. The truth is farther, well, the reality is farther from the truth. FES improves spasticity, and that is proven in the specific study in which we control the angular velocity of the muscle, active, passive, and stimulated by FES. And the FES had better spastic control. So we talked about the fact that FES improves muscle mass, and we talked about the fact that it improves spasticity. Well, it also improves function. And in our study, we looked at the functional independence measure, which is a very well approved outcome measure for rehabilitation. And if you look, individuals undergoing FES, that's on the right side, had statistically better self-care function, sphincter control, transfers, and locomotion. Now, FES did not improve communication and social cognition. Otherwise, I would have sold it to you hook and sinker.
Oh,
With that said, though, let's go back.
okay.
There is one more thing. Quality of life, as quantified by short form 36, which looks at physical function, looks at role limitation and performance, social functioning, and mental health. The individuals that underwent FES for that period of time, and the period of time, the average period of time was a little bit less than 2 years, was 19 months in this study, had better physical function and less role limited functional limitation. So not only that it improves the muscle mass, the spasticity, the day-to-day function, but it also improves quality of life.
I agree. Absolutely agree.
And this is from a different study that we did. Again, a clinical study. We only do, I only look at the clinical effect. I like to look at the animal model, the rats, the pig, the monkey, the cat, and so forth, because it gives me an idea what next to do for the patient. But in the end, for me, what's important is to have improved function in individuals with paralysis. So we looked at about 600 patients in our unit and that were undergoing FES. And some of them had improved the light touch score, especially if you had a more severe injury, as seen in the second panel there. The Asia A and Asia B had improvement in a light touch score. And again, we've proven in the clinic setting that the SCIM score, which is another functional outcome, and the short form 36, which we talked about as being the quality of life, is improved in individuals that do FES as part of their clinical care. This is not a study. This is actual rehabilitative care in a regular spinal cord injury clinic. So this shows the power, the translational power. Start in a study, you show that it works, and then you take it to the clinical application, and it still works. And now I'm just going to talk a little bit about muscle mass, because a lot of people, maybe healthcare professionals, say, well, what's muscle mass got to do if you're paralyzed? Well, it has a lot to do with individuals with paralysis. We know that muscle mass restores ability to function, improves those SCIM scores and the FIM scores, the day-to-day function, improves bone and bone mass, and we know that individuals with paralysis have decreased bone mass. And like in this specific, very busy, a lot of points slide, that all those points are patients. What we've seen is that individuals with tetraplegia that do not have a maximized functional outcome score, because people with paraplegia, they maximize their scores because they are mobile from the chair, they can reach, they can get dressed up on the lower limbs. But people with tetraplegia, C1 to T1, that have increased their lean body mass as a consequence of FES, have increased in mobility and ADL scores. So I don't know how much more functional to make my argument. Yes, there are physiologic benefits, but this is about day-to-day function. I'm not talking about the moon in the sky here. I'm talking about getting dressed, getting a glass of water, or signing your name when on a card to your significant other for their birthday. We have estimated that for every 100 grams increase in lean mass, there is a 2.3 unit increase in bone mass and 0.07 increase in spinal cord injury total score. And for the women, it's actually a little bit better in the bone. So there is quantification. It's not that this is science. Increase the muscle mass using FES, and you have all of these other benefits that are day-to-day or physiologic.
And that's all right. So I wanted to say, Dr. Sadowsky, that that was amazing, but you got me thinking about every single person I've ever met who has used FES with a spinal cord injuries. I call them my extended brothers and sisters, and even my own life deeper, and thinking that everything, whether it be appetite, whether it be everything that I go through on a daily basis, is that it's improved when I've done FES, like repeatedly. It's when sometimes when I'm traveling or something and not doing it on a regular basis that I see the drop off. So it's amazing what, and I guess the best way, and you described it nicely, is that, you know, just think of someone who's able-bodied, who's constantly exercising everything, whether it be a bladder, bowels, sexual function, everything seems to benefit when we're getting movement exercise to the body. And this is the one way in which we could get our whole body moving the way it belongs to be moving.
Yeah, and one of my pet peeves is that exercise is not a luxury. Exercise is a necessity, just like good nutrition, good mental health. In fact, exercise contributes to that and prevents consequences of immobility. We tend to look at exercise as being, oh yes, you go to the gym and you have the time. You need to make the time. You make the time to eat, yes? You need to make the time to breathe, because otherwise you turn blue. You need to make the time to exercise. When you have paralysis, it might be a little bit harder to engage those bigger muscles. So that's why you need the FES.
Dr. Sadowsky, no excuses. I think that's going to be your tagline now. I think that's great. Well, we're going to give you a breather right now. And I wanted to ask Wendy, how soon after spinal cord injury would you say is beneficial to initiate the use of FES and FES cycling?
Oh, that's a great question. Well, I've had the opportunity to visit ICU units, installing and providing training for our RT300 supine, which is an over-the-bed FES integrated leg and arm ergometer. So you can actually start using that type of therapy as early as in critical care, depending, of course, on if the patient is physiologically stable and a variety of other factors. And, hospitals that I have visited all around the US and Canada and Australia are implementing these programs for early mobility where they're utilizing tools like the RT300 earlier and earlier with patients to help, just like Dr. Sadowsky described, offset this muscle wasting and atrophy that happens so quickly after a spinal cord injury or other neurological injury. And we've found, and studies have shown, that early mobility, even incorporating, supine cycling with FES as a tool, has shown that there are better outcomes. Patients are more stable and able to participate better when they move to the next level of care, like in inpatient rehab. For example, it can lead to, reduction in length of stay overall, decreased cost, improved function. So, starting stimulating your muscles as soon as is reasonable and approved by your doctor and facility that you're in is a great idea. And it's really important, actually, because there becomes an urgency, that we don't want this patient to lose so much of their muscle mass, and want to give them a head start and help them maintain that physical integrity of their body, which, as Dr. Sadowsky just described, is so incredibly important.
So, and this could be for you, Wendy, or Dr. Sadowsky, is that obviously we can't change the past, but if you're that patient who's watching now and saying, that was never offered to me, why not? We know that there's never a wrong time to begin using FES, at least to try to use FES. But what do you say to that person who maybe has a little bit regret of saying, why wasn't that ever proposed to me?
So let me put a caveat here. I think I would avoid starting intense activity in the first 2 weeks after the traumatic injury, to avoid this secondary injury cascade, because those set in minutes after injury and last for about up to 2 weeks. And during this phase, the area of the trauma could actually enlarge, because some of the features of secondary injury are activity dependent. So I would probably just start slowly with just range of motion, mobilization, small amount of, I'm not saying it's contraindicated, because there is no study to shows that it hurts. I wouldn't be providing intense FES in those first 2 weeks following spinal cord injury. But after that, you asked, what would you say to those that didn't have it offered to them? Is, don't look back, just look forward. You lost it, but FES can restore it. So don't don't cry over the spilled milk. Just make sure that from now on, you direct your care and you educate your provider, because some providers do not know about FES usage. Spinal cord injury, again, is rare. You, Scott, are the specialists because of your body.
Well, I can tell you as well, I meant from my perspective is that I had FES very early on. This was back in 1986 when I was in rehab very early on. But then all of a sudden, I took a break from it too, because I was doing bicycling, and I was trying to do a standing device as well with electric stimulation. And I felt, and this was just me, that the combination of the two started like playing some games with my bladder. So I ended up doing just the cycling at the time. Again, that was me. And just like there are no two spinal cord injuries alike, I meant there's no two people who are going to respond exactly the same. This is why we're adamant about at least taking it for a test drive. You said it yourself, Dr. Sadowsky, is that like, I'm the expert of my body. Everyone who's listening to this, you are the expert of your body. So you try it out, see what works for you, how long you can go for, to what extent, which limbs, if you're a tetraplegic. So no, it's very reassuring to hear this. Gabby, we have not forgotten about you. So I'm going to ask you now. We understand the benefits to someone like myself with paraplegia. How does this benefit those with tetraplegics, quadriplegics?
Yeah, I think, it has so many implications. I think when we think about our tetraplegic patient population, right, there's not only upper extremity involvement, there's more involvement of the trunk, weakness and respiratory muscles and all of those things that are, certainly even with our paraplegic patient population. And we have that ability to provide FES to a lot of those muscles, like things like your scap stabilizers, your shoulders, if there's like an instability, right? And getting us and any of our core and trunk muscles and, getting those stronger and more conditioned really helps us to do all those activities that Dr. Sadowsky so nicely talked about, right? All of our functional tasks. So reaching for a cup and getting dressed and being able to affect those. We've seen it used even for, certainly postural control. I've had patients who it may not show up on an outcome measure like a FIM or a SKIM, but, after using FES as part of their treatment plan, being able to say, hey, Gab, I can lean forward and help my wife, with a transfer, or I can do a weight shift. I can, do my own lower body dressing. And when I don't use my cycle, I can't do that when I skip a week. And so those are all of the benefits. And then being able to even affect, someone with maybe emerging hand function and getting that to be more refined. A lot of what we see too is really avoiding, when you think of the tetraplegic arm, there's a lot of compensation, right? So you're having to, you're using certain muscles and compensating in a way to get your arm to do something that you'd want it to do like before. And we end up seeing that carryover of all those really nice skills where you get the right movement pattern to do what you need to do and then get that, on that path towards recovery. So it's a really great way to just integrate that into their plan of care. It is a standard of care, which is great. And back to your last point, I have to put my 2 cents in. I think it's always something where, we get calls often where if someone says, hey, I didn't get this intervention, and like Dr. Sadowsky said, don't look back, that they may call us and say, where can I try something like this? And certainly, we can provide that information as well. So I always love those calls. And hopefully after something like this, you have, individuals who might reach out to you, Scott, and say, hey, where can you, get this, and certainly direct them to it. So always super helpful.
Well, that's the beautiful thing too about FES is that, and again, I can't say this enough, there's never a wrong time. So there are people who are getting it very early on. There are people who 3 decades into his or her injury and are benefiting from this and everything. So you have to at least try it. I'm not sure, and I'll put this out to the panel if we've brought this up yet, or maybe I just missed it because so much information has come in. Temperature wise, how much does this have an effect? Because I know some people will run cold, their legs or their upper extremities may run cold. How much of an effect does FES have on one's temperature? Obviously, we're getting movement to the body and blood circulating. Does it have a dramatic effect with temperature of the body?
I'm going to say I didn't look into this, so I'll turn it right to you and ask you, do you feel better when you're cardiovascularly conditioned and have more muscle? So are you more comfortable in a colder temperature? And I think that the answer is yes, but
No, you're absolutely right. I just I love how my legs usually run cold, and then after doing some cycling and everything, is that they feel like kind of like my upper body does after doing that. I just didn't know if that's usually the case with people. Is that based on the amount of stimulation that they receive and where they receive it? If they notice that their body temperatures even out, if quadriplegics and paraplegics.
well, thank you. That's one area of research I have to do.
Okay.
I don't have the answer.
Okay. Gabby or Wendy?
Yeah, we do hear from patients sometimes that they improve their overall autonomic function. And so I think that kind of the FES, like Dr. Sadowsky was saying, is kind of providing this overall input to the entire nervous system. And so that autonomic nervous system that's regulating all of those temperature control and all these important functions, I think that there is a benefit there internally. I don't know the science behind it, but I certainly have patients tell me that they can tolerate temperatures a little bit better. They may have frequent autonomic dysreflexia, and that kind of dissipates, especially if they start using the stimulation for the first time. They may have some symptoms of dysreflexia that go away pretty quickly after they, start a normal program or a regular cycling or FES program. So there's a lot of different benefits that we hear. Just like you said about the circulation, I've had a lot of patients tell me that they can actually feel the warmth to the muscle groups that they're stimulating with that, kind of improved circulation to those areas. So those are things that we hear our patients say quite frequently.
Wonderful, wonderful.
So I'll ask you a question, Scott. You talked a little bit about how you were introduced to FES early on in your rehab. Can you talk a little bit about the other times throughout your rehab, maybe that you have used FES, and then what benefits did you see personally?
Yeah, no, and I think it was self-esteem for me in the very beginning, just to see my body moving in a motion that I love to see it move for the first 15 years of my life. I don't think I mentioned that I had a rare spinal stroke, so I didn't have an accident or an injury. So there was no worry about any kind of broken bones or anything at that time. I do have a broken femur, though, that has healed, that I've had to use the bike on now and everything, and there's been no problems. But I absolutely saw self-esteem. But again, and I'm going through everything based on what Dr. Sadowsky said, is that when I am using it consistently, I can absolutely tell that whether it be catheterization, is that it's much better. There's fewer voiding going on, so less accidents. My bowel routines are much better. The sexual function that I have, it can only be attributed to consistent FES use. So I see it across the board. I will say this, so I am currently using the bike about 3-4 times a week. But the times that I don't, whether it be a busy schedule or something like this, is that I have a little TENS unit that I use. I get on my stomach and I actually put 4 electrodes back on my glutes. And so that's why I was so excited to see Dr. Sadowsky's chart of saying glutes. We saw like a massive increase there, because I've had some pressure sores in the past and everything. So like while I'm on my stomach, and whether it's doing some work or watching television or just with the family, I'll put the electrodes in for an hour or two, is that I will fire them up. And I know it's not to say that I don't do weight shifts or anything like that anymore, but I know I have an extra layer of protection now because I've gotten those working. But I see the same benefits when I'm riding the bike, is that to see, like when I'm done with it, and to look at my skin, I began with self-esteem, and I'm going to come back to self-esteem, because it's troublesome sometimes to look at a paralyzed body, and to see the discoloration sometimes of it, to see the atrophy. But when you do FES consistently and everything, you start to have more respect for your body. You start to think that, wait a minute, it's there. They're kind of just sleeping right now, but through the movement, you see muscle mass. And I know it's interesting for some people to hear that out there, muscle mass, tetraplegic. Yeah, muscle mass in your arms. If you're tetraplegic, in your core. I mean, there's even electrodes you could put on your core. I mean, my kids say I have a para pouch. They haven't been saying that a lot lately, because I've been doing a lot of exercise on my core. And then you look down and you see your legs. Everywhere where you put an electrode, you will see like the redness, which is great because you have the electrode there, but then you'll see an increase. And I will say one more thing too, is that I don't have a lot of spasms. And I know that spasticity really disrupts a lot of people's quality of life. I will say this though, is that I do get them from time to time. And sometimes when I first go to sleep, being in that prone position that I'm not in all day, is that sometimes that will trigger it. Doesn't trigger it at all since I've been using the bicycle. So for me, it's benefited immensely with regards to really reducing, if not eliminating for a good period of time, my spasms throughout the day.
That's great. I think we forget all the circulatory benefits that come with it. So like yourself, someone who maybe has a, history of a pressure sore or things like that. And then the spasticity, I've had numerous patients who it's impactful, where it's almost an inability to concentrate, because it's sort of coupled with just discomfort and pain, and being able to dampen them a little bit is really critical for so many.
Oh, you mentioned pain as well. So there's something, I always laugh at this term, paresthesia, And when they first told me what that was, I was like, what is paresthesia? They said your body's reaction to paralysis. I said, oh, okay, that makes sense. But the pins and needles that a lot of people feel is that, yes, and I've had that since day one, and it does heighten, but that actually increases, which is interesting, while I'm riding the bike. But then when I need it to calm down afterward, it dissipates. But please understand, everyone who's listening to this is one person's perspective, and we're going to have a number of people on different episodes to get their perspective. But this is like a car. This is like anything. You have to take it for a test drive to see if you like it. So that's what we're encouraging, knowing full well there's not going to be any detrimental effects. There's not going to be any damage that you're going to do by trying it out, and really want to illustrate that point. So thank you for that question, Gabby. Hey, Wendy, how has, during this period of time of COVID, how has the last year impacted patients getting access to FES and FES cycling?
Yeah, we've actually seen so many patients get RT300 FES cycles for home because in many cases they've not been able to access the healthcare system, which is just a historical time. I can never, or I would have never imagined a time when outpatient therapy would be completely closed. And then, with the period of time during lockdown, we were able to, myself and the team of clinicians at Restorative Therapies, support patients remotely to help them get set up on their systems and train their family members via Zoom. And additionally, all of our systems connect to a database, which allows us to provide like a telehealth service where their settings can be adjusted remotely and optimize the stimulation for them to, get the best possible muscle contractions within their comfort level. And so we've provided this type of training support to over 150 patients in the last year remotely. And then of course, we're able to now resume doing some of these things back in the home again as needed. But we've seen patients who have not been able to access therapy at all. We've seen patients who have had a brand new injury get discharged very quickly from inpatient rehab, more quickly than they normally would have. We've seen patients who want to go back to outpatient therapy, but even when they reopen, they're at limited capacity. So the wait lists have been very, very long. It's taken them a long time to get that skilled service. So it's been a tremendous way for them to have a tool in their home that they're able to use to not only, maintain their health and all the things that we've been talking about, but also to just not lose function during this time. We know that patients can so rapidly decline when they're no longer in skilled therapy. And this, gives them a tool to use to not only maintain their baseline, but actually improve their function. So yeah, we've seen some fantastic success stories, and we're really grateful that we've been able to have the capability to help so many patients at home during this time.
Well, I have to tell you, I'm one of them. I have to give a big shout out to RTI, because there was a time where there was an imbalance, and it happens. If you can just imagine a pedal falling off a regular bicycle or something that needs to be adjusted. I mean, everything needs to be adjusted. And basically got on a telehealth call with Gabriella, and who was on with us, Gabby?
Tian, I think.
Tian was on with us, and it was just amazing to see, like, do this. I mean, I had some family members who would help, but I probably could have done it myself if they weren't there. But I was like, wow, I mean, this could be beneficial. I'm worried, Wendy, that there's going to be a lot of people when this pandemic's over, they've made it so seamless that aren't going to want to leave their house. I just got to do a telehealth, and like I can take care of everything from there. So no, but it's been an excellent process. And I think there is actually going to be of great benefit from this experience of the pandemic to having that combination of in-person and also telehealth experience.
I agree. We know from our patients, even that transportation to a center is often, a real challenge for them. So just being able to access the equipment, more routinely, we know that they need to really be using the equipment 3 to 5 times per week in order to have the optimal health benefits. So just having it there in your home allows you to have that kind of frequency of exposure to FES, which is really needed to, achieve these health benefits that we're talking about. So yeah, I think there's a lot of learnings and a lot of good things that come out of this experience.
Well, everyone who's listening right now, this is just episode 1. I'm going to tell you we're going to be bringing back this distinguished panel because they are phenomenal and we've learned so much. We've gotten a history of FES, its application, tetraplegics, quadriplegics, but there's so much more to discuss. We want to discuss in terms of almost like from A to Z, what the process is, whether it's once you leave your house, because we're all going to leave the house at some point, and we go to a clinician and we're tested. We're going to take you through that so you can physically see that. Maybe I will be the guinea pig for that. And maybe we'll even take a trip down to Kennedy Krieger and do that to get Dr. Sadowsky involved. So I'm saying this to, again, my extended brothers and sisters with disabilities. There are going to be no excuses out there from anyone, at least, not being able to try this. So ideally, we would love for you to use FES in a clinic, at home, wherever you might be able to basically get as much movement in your body as possible. So again, we're going to be talking about funding, how insurance gets involved, all different things related to FES and how it can benefit you, because we want to see more people, because again, as we said in the very beginning, movement is so important to our physical bodies, even though they are paralyzed. So again, I want to thank my guests, and knowing full well that there's contact information that's made available now that you can reach out to each one of them if you have a question, a further information that you'd like to share about yourself with them. Again, any questions and concerns, we'd love to answer that. And we hope to do even more of that in future episodes. So thank you for tuning in. And again, thank my panel for joining us tonight.
Thank you.
Thank you for having us.
Thanks.
Thanks, Scott.